is CGTN, China Global Television Network.
China salutes its heroes in the fight against COVID-19. Key figures in the struggle were commended in a national award ceremony here in Beijing and attended by Chinese President Xi Jinping. With the pandemic now under control within the borders, China is in a better shape to share its experience with the world. But can the Chinese approach be replicated elsewhere? And what lessons can the country share? With more than 27 million cases of infections around the world, when will the pandemic stop? And is the world failing in its response to the global health crises? To talk about these questions, I'm joined by Professor John Gong from the University of International Business and Economics, Zhou, a doctor at Cardiology Department at Tongji Hospital in Wuhan, and Eric Ding, epidemiologist and health economist at the Harvard School of Public Health. That's our topic. This is Dialogue. I'm Zhou Yue. So let's talk about the top doctor that is being awarded a title. The pulmonologist and identified the SARS virus in 2003, Dr. Zhong Nanshan, and this time he was awarded again in his efforts to contain COVID-19. First of all, why do you think China need to award epidemiologists and doctors and community workers in the COVID fighting?
I think first and foremost, these people save people's life, right? He was the first person to stand out and say that we need to do something about it. During that trip to Wuhan, and he famously said that we've confirmed the fact that widespread transmission is happening. Human-to-human transmission is happening. I think it takes a lot of guts to say these things at the time, looking back, and I think the fact that he has the courage to say these things is something to be laudable and certainly to be commended at this point, let alone his expertise, his achievements scientifically in combating the disease, in saving people's lives. He's a practicing doctor. We should remember that, and I think, and then if you take into account his contribution during the SARS period, I think definitely Dr. Zhong is going to leave his mark in history. We owe him a big thank you. So it's this ceremony is long overdue in my opinion. We waited for so long, and up to this point that we finally organized this big celebration. It's a triumph against an unseen virus, an enemy that we don't see, but it's a spectacular success.
I want to also ask you the timing. Why does China choose this time to have this kind of a ceremony? Because infections around the world hasn't stopped yet, and there might be another surge of COVID in autumn, even in China. Why China have this ceremony now?
Well, I can think of two reasons. One, of course, is out of the security concern. I mean, the virus still spreading, as you said, around the world. So we don't want to, especially in Beijing, we don't want to get into a situation that this cause another spread because of the gathering of so many people. And second, I think the government is a little bit cautious about, declaring a victory prematurely. We do see coming back occasionally in isolated spots in China. And I think the government is now confident enough to handle these things, even if it comes back again. The experience we have seen in Beijing, for example, this mini break, in Xinjiang, in northeast province in China, and in Shenzhen, have repeatedly demonstrated that even in the event that this thing does come back, we have a way to handle this. We have developed a very mature and organized, mechanized means of handling this. So I think the government is confident enough to declare victory. So I think that's the reason we've been waiting for so long for this.
And Dr. Zhou, I know that you also been dealing with COVID virus in the front line from the very beginning. And What is your understanding of why the Chinese government have such a ceremony to give such an honor to those top-notch experts and epidemiologists and vaccine researchers?
Yeah, thank you for your questions. Today, the Chinese central government awarded the highest honor to these 4 medical doctors and scientists. So I think this reflects 2 things. The first, the Chinese government will never forget those brave people who fought for the people and shared the country's worries in the times of national crisis. And secondly, I think because these 4 people are medical professionals, they are scientists and doctors. So I think the central government listened to their scientific advices and successfully controlled the pandemic in China. This reflects that our Chinese government respects science in the fighting against the pandemic, and they respect the principle of medical laws. So I think this ceremony is very important because Dr. Zhong Nanshan is the most well-known respiratory experts in China, and I think they deserve the top honor in China. Thank you.
And John, also Chinese President Xi attended the ceremony, and he delivered a long-winded keynote speech. Right. And he basically summed up the experiences of China's efforts in dealing with this new virus. What do you think are the main takeaway for you?
Well, he mentioned a lot of things, but I think that impresses me most is 2 places in the speech that he really touched upon the international aspect of this. And I think what he said is that, first of all, this is an international effort. We do participate in global cooperation to combat this disease, this virus. But he also pointedly said that some of the wrongdoings, perpetrated by other countries, and he's not shy about saying this. He said that turning things around, saying black and white things, it's not right. Okay, so I think to some extent, this is a big response to the early criticism. We still remember that of the Chinese government. But looking back, I think we really feel vindicated in terms of achieving a great success at this point. I mean, there are a lot of things we can talk about and debate about in the earlier situation when it first broke out. But looking back, these things doesn't really make much of a difference, in my opinion, because it's going to be the same way anyway.
It's not just early criticism. Recently, President Trump still labeled China for causing all the havocs around the world by COVID.
Well, he is doing this for his bankrupt campaign, I think. He's still trying to divert American people's attention. The fact of the matter is, the 2020 election is a verdict on him about his handling of the coronavirus, and it's a total fiasco for him. And American people are paying a price for that. So what he's doing right now is to divert attention. He's saying, well, this is somebody else's fault, right? But honestly speaking, even if Chinese government did, for example, lock down Wuhan, maybe just 2 or 3 days earlier, I would bet today's America would be the same thing.
Wow.
Millions and millions of people are infected. A 250,000 people are dying. It would be the same thing. So, he is doing his own campaign strategy, but in hindsight, I think he's going to be voted out.
And Dr. Zhou, a good example of how the virus is contained is look at the epicenter, Wuhan. Now, Wuhan is back to normal, and recently we've seen photos of the Wuhan water parks filled with people and the schools in thousands opening to students. What is it like in Wuhan right now, Dr. Zhou?
Yeah, as you said, Wuhan is already back to normal, and the market is reopened and the schools reopened. The kids are going back to their schools after 200 days later, and I think the epidemic of the coronavirus in Wuhan is already stopped. Is already gone. We don't have any new cases in the last months. So I don't think there's another wave of the coronavirus will will be back to Wuhan recently. But be careful that in the after the summer, after the very hot days, there comes the winter. If it comes winter, some virus will come back again. So just be very careful to be infected by the other virus. It's not coronavirus. I mean, to keep healthy, to to do some exercises to get yourself stronger, to protect yourself. So
do people in Wuhan still worry about a second surge in the fall?
Somebody are very worried about the second waves of the coronavirus back again. But I don't think that the coronavirus will be back to Wuhan again, because we have a very, very strict protection. For example, if our kids go back to school, they will be detected by the body temperature, and they will be record any symptoms like a cough, fever. If they have a cough, a fever, they will be not allowed to the hospital, allowed to the schools, and they will be observed for a couple of days to make sure that they are not infected by the virus. So somebody are worried about the second wave, but I don't think that's not a big issue now.
A lot of people around the world are really confused, I can say, or even shocked seeing what has happened in Wuhan. So John, what is the key to China's success in containing this virus, although China was the place that the virus first broke out?
Well, I cannot think of anything else more than the whole of a nation approach that this government has adopted in dealing with this. Remember, in the late January and early February, we have hundreds of thousands of medical personnel, doctors coming from different provinces, rushing to Wuhan, right? We have sending materials, medical supplies from every province to Wuhan. And we have those medical doctors fighting in the front line with people in Wuhan. And this is something that you don't see in other countries. I mean, rarely you see in other countries.
But that has happened only when Wuhan is locked down. Nobody was allowed to go in and come out of that city.
Right.
And that, in that case, all the other places can send their help in.
Well, I mean, I think that the lockdown itself, in my opinion, is also part of the whole nation approach. I mean, that means that the central government is taking strong actions to make sure that this city is locked down, right? When we say lockdown, we really mean lockdown.
But other places around the world also practice lockdown measures. They didn't work as well as Wuhan did.
Well, I mean, this has to be to do with how the governance works here in China. We have very strict enforcement of these measures. For example, we wear masks. You have to wear masks. Social distancing, contact tracing. How many countries in the world can actually do the kind of contact tracing that we are doing here today? Even today, even we have new case today, right? We still have the contact tracing. I just came back from Shenzhen. Let me give my personal example. I came back from Shenzhen a week ago to attend a meeting, a conference, and I was not allowed to go back to the university because I have to stay at home. Only after I've taken a test that I can go back to school.
So do you think this is a government performance problem or technology problem? Because China is very advanced.
It's both. I think it's both. Absolutely, it's both. I mean, both are very necessary to enforce.
And people's commitment to this. And people are willing to accept this.
I think what you're talking about, the people's acceptance, has a lot to do with the Chinese culture, in my opinion. We tend to value collective interests more than quote individual liberty, I guess. I have a famous saying when I keep saying this during the heydays of the coronavirus. I said, give me I would sacrifice liberty, basically. I would sacrifice liberty for life, okay? I would sacrifice liberty for life. I mean, this is saving people's lives. This is serious.
Or trade some parts of your liberty for some time for the lives not only of you, but also of your colleagues and families and friends.
Right, exactly. This is, I think in China we have this tradition of varying, collective interests. It's to everybody's benefit, right? I mean, the simple example of, think about this, how many lives have been saved by wearing masks? as simple as that, right? In Northeast Asian countries, in Korea, in South Korea, in Japan, here in China, people are accustomed to wearing masks. Today, we're still wearing masks, okay? Nobody's arguing against wearing masks. Think about how many lives have been saved just for that reason, okay? And I think, this big infection numbers in the United States has a lot to do with people's reluctance to wear masks, at least in the early months of the breakout.
Yeah. And Eric, when we are looking at COVID and its impact on the world, we cannot avoid comparing different countries' response, their approaches, and the effects. First of all, what is your assessment of China's response, and how would you compare it with other countries in Europe, North America, and Africa, for example?
Yeah. China definitely had a really bad early epidemic, but China was very aggressive, and the degree of aggressiveness eventually paid off, in which now China has little to no cases other than a few import cases. But meanwhile, it's not just small embers, but it's a burning wildfire in many other countries, especially in US and Latin America. And so I think it's the motto, a short-term pain for long-term gain.
But
that
do you think that kind of aggressiveness is a product of their culture, or is it government's choice, or if it's people's cultural preferences? What is the main reasons for China to respond the way it did?
I think it could be many different ones. For example, the availability in testings early on, a few lab errors caused a lot of slowdown, but also poor leadership in the U.S. in which, Trump didn't endorse masks until June and July. That was very, unfortunate. And the social reluctance to wear masks and to have strict lockdowns. Many countries, the lockdown rule was 1 page, but the exemptions were 2 or 3 pages. I think it's just the degree of intensity that made a lot of difference. But we know that this can still come back, and New Zealand did a really good job, but even then New Zealand still has small epidemics here and there. So no one is out of the woodworks, and you can't say for sure that China will be free of this epidemic.
Of course, but people still ask the questions of what if. For example, what if Trump were not the president? What if the CDC didn't cut back on international cooperation and has a closer cooperation with the Chinese CDC in the early times? And what if there are more effective cooperation internationally under the auspices of WHO? Eric?
Yeah, absolutely. There should definitely be more data sharing. I think China could have improved its data transparency with the WHO early on and shared it with many other researchers early on. China was a little late, but then I think compared to many other countries who were in their response was even later. No one gets an A in this global pandemic. We all learn, but I think some of us learn quicker, and I think in the end we have to work together because it is a pandemic. Unless we work together, we'll never be able to fully conquer this, and we don't want this to go into 2022.
Yeah. We've also amassed some opinions from social media users on what went wrong in our response to COVID. Let's take a look at what some of them have been saying. Frank Romeo said, "It is a pity that an outstanding scientist like Dr. Fauci was misunderstood in the USA recently. I think every country, especially when the COVID-19 hasn't been totally controlled, should respect the scientists who are trying their best to stop the pandemic." So, John, it is very interesting to compare the people's attitudes towards scientists and authorities in their own cultures. For example, China give the highest honor to Dr. Zhong Nanshan. That's Chinese Dr. Fauci. Why in the US, it's probably different. Why the Chinese respected experts? Is that playing a role in helping contain the virus?
No, I think American people really respect experts. I think Dr. Fauci is widely respected, other than just one person in this White House that who has
But
pushed
he
him
has
aside.
quite a following who agree with him that
That's
Dr.
the
Fauci's authority.
You're absolutely right. That's the bad example he is setting up. He has muted Dr. Fauci in a sense, right? He has thrown out these crazy, unproven, totally unscientific medical solutions right in his face when he was standing right beside him. He was talking about the.
Nobody in China questioned the authority of Dr. Zhong Nanshan or his analysis or decisions on where this virus is going.
I think what you're trying to refer to is really the leadership. I think the leadership plays an incredibly important role when the presidents of a country, 300 million people, they are looking towards the president, right, to take the leadership role. And he has totally failed the American people's trust. He said all these crazy things, he has proposed all these crazy ideas, and he refused to wear masks. I mean, the list goes on and on and on. So I think there's going to be a reckoning on November 3rd. By the American people about his leadership.
But probably, Eric, this is going to be a moment of reckoning for all Americans, whether they respected truth, respected science, otherwise what will be the consequences? What is your analysis of why Americans have problems with science and data and truth?
Well, I think only part of America. Right now, the news and information networks are hyper-partisan. And in one case, the right conservatives who back Trump completely ignore the mainstream media. And the mainstream media just does not broadcast to those. And Fox News has a very completely different narrative. And, for Fauci, again, half the country, I think 2/3 of the country trusts Fauci, but there is a small pocket of Trump loyalists that do not listen to Fauci, do not listen to science, and oftentimes lend ear to QAnon conspiracies, which are woefully dangerous. And I think this split is what's causing so much of the divide. And I think some like Rupert Murdoch's Fox News and many other conservative shows like Sinclair network-owned TV networks have fed into that. And it's very unfortunate that that's happened. But I think there will be a reckoning. Most people do believe in science, do believe in expert opinion, and they will see that Trump has been a really poor leader in this pandemic.
The reason I want to ask this, probably not so many doubted the authority of Dr. Fauci, but they don't necessarily follow his advice. For example, many Americans still don't wear masks. They don't still keep social distancing rules. It seems there are some deeply rooted cultural problems that is keeping Americans doing what is required for this public health crisis.
Yeah. No, definitely there is a small segment of population that's anti-mask, anti-lockdown, anti-almost any social restrictions in public health interventions to fight this. And in many ways, that's very unfortunate. And the frustration is with cloth masks. Cloth masks only protect you, protect others from you, not you from others do not wear masks. So that just, if small population, if it's 25% that keeps doing that, this epidemic will keep going. And it's part of the information war. It's part of this political psyche in which identity, in which how they identify with Trump. And this is why a polarized, society under Trump is very frustrating. And that's why America needs to come together, and it has a big decision to make on November 3rd.
And Dr. Zhou, COVID-19 is probably the most effective, consequential global public health crisis since the 1918 influenza pandemic. But what do you think it will affect the public health system in China? Because people are blaming the early response from the CDC in China for not being so effective, so timely in the very beginning. Do you think this might change China's public health system?
Yes, as you said, the COVID-19 epidemic changed a lot in China, especially for our public health management. So in the very beginning of the outbreak of COVID-19 in Wuhan, we respond to this outbreak, it's a little bit late, because when we find some infected patient in the early of the January, our government, like CDC, don't have a very rapid response to this epidemic. And after 1 week after we find the first COVID-19 patient, we identified that the virus is the SARS-2, that virus. So I think we should learn some lessons from the lessons of the COVID-19 in the very beginning. In the later, we should respond more quickly than before. And for our CDC government, the CDC should have been more authority and more power to identify, to find, and to do some work in the management of society. They should be more authority, I think. And for our public, for our hospital, and for our medical doctors and nurses, I think we should get more trained to be more sensitive to the public health crisis, like the outbreak of COVID-19 in the future.
And John,
so we should
obviously there is lacking of international cooperation in the early diagnosis, in the early prevention of this epidemic. But do you think we might see more international cooperation in vaccine development?
Well, it's happening right now, and we have, I think, in China we have at least three vaccines that are being tested in the third wave of clinical trials, and they're being done in other countries. We don't have any cases here in China anymore, right? I know we're doing this in Brazil, in Pakistan, in UAE. So that's one example of international cooperation. So I think, and actually I think our government also has committed to make the vaccines available to many poor developing countries when it's available. But again, I want to point to the fact that there's one very large country in the world that refuses to cooperate with WHO, doesn't participate in the WHO vaccine program, and we all know that country, where the country is. So that's very unfortunate. But I think there are more options out there. At least I know, we have three here in China. There's one from UK, and there might be other options as well. So I think even without participation, cooperation from the United States, I think it's quite likely that some kind of effective vaccine solutions could be available sometime next year that can save a lot of people's lives in other developing countries.
Eric, of course, we are talking about the United States because it's leading in the efforts of vaccine development, but can it also be a leader in international cooperation in vaccine, not only production, but also distribution?
Yeah, it's very frustrating why Trump administration has refused to join the COVAX, the WHO-led consortium. If anything, we need an insurance policy, like no vaccine. We do not know the success of any vaccine yet. There's no data. So by pooling together and sharing resources, we actually can potentially access other vaccines that could be a little bit more successful than this one. This one might need a booster. This one might need a cold chain. But by U.S. foregoing that, it puts all its eggs in one basket, and that is much riskier. And it's very unfortunate because we need the risk pooling and risk sharing in order to make sure we have the right perfect vaccine of great efficacy and easiest transport and use in production. And so it's very unfortunate what Trump did.
Well, I want to add that President Trump is also pressuring the FDA to rush out the vaccines, and that's very, very dangerous in my opinion.
Yes. Oh, yes.
So there's no...
And the pharmaceutical companies are actually pulling together to fight back against that. They refuse to apply for an application for use until all the phase 3 results show
Thank you,
success.
Eric. Cutting corners is definitely not suitable for vaccine development. Thank you very much, Eric. Thank you, Dr. Zhou, and thank you, John. You've been watching Dialogue here on CGTN. I'm Zhou in Beijing. Thanks for watching. Goodbye.